I don't want to see me shaking. Sometimes my whole body shakes, and I know God's going to be there with me. I just want to be able, maybe through this, maybe I can help someone else.
10 years of not being able to write or eat without severe shaking. But that all changes today. It is a big day for this woman, Evelyn Brown, who is our 100th patient with essential tremor as she undergoes a procedure aimed at stopping it. We will meet her and talk more about this medical intervention changing so many lives. That's coming up now on the Morning Medical Update. And good morning. It is Tuesday, May 17th. Thank you so much for being with us here on Facebook, on YouTube, and on Twitter. A live look now as the woman you just heard from, Evelyn Brown. She undergoes focused ultrasound, a sound wave that targets the area of the brain causing the tremors. As we mentioned, this is the 100th case to be performed here at the health system since doing this procedure and starting it here at the health system a year ago. We're going to talk with her doctors coming up in just a bit. And coming up in just about 15 minutes, Dr. Dana Hawkinson shares the latest COVID numbers and headlines with us. Plus, as soon as today, kids between the ages of 5 and 11 could get their COVID booster shots. So get your questions sent in to us on YouTube, Facebook. You can email us at the Medical News Network. You can find links to all of those right there on your screen. Our 100th focused ultrasound patient has been in the operating room here for a few moments. To learn more about Evelyn's case and how this procedure will help, we are now joined by Alexis Del Cid, who is outside the OR with her neurologist. Okay, we are going to check back in with Alexis Del Cid here in just a moment. Are we back with Alexis? Hey, Alexis.
I'm here, Jess.
Okay.
I'm going to grab our neurologist. Our neurologist is Dr. Vibesh Sharma. Thank you so much for being here. They're busy in the control room. If Cliff wants to scan, that's the MRI control room. That is where we also have our surgeon, Dr. Michael Kinsman, and all the RNs and medical staff will be going in and out prepping. They're getting ready for Evelyn to enter through these doors behind me and begin the procedure. Dr. Sharma, we only have you for about 15 minutes, so I want to get to these questions first. This is a non-invasive procedure. This is the 100th procedure. Why did you feel that Evelyn was a good candidate to refer for this?
So Evelyn has been having this tremor for almost around 15 years. And over the time as her tremor got worse, she was having difficulty in doing all the activities of daily living, including eating, drinking, writing. Also, it affects her hobbies. So after she tried multiple medications, she was not getting adequate benefit. And then we did a careful evaluation. She had a careful evaluation by the team and considered a good candidate to improve the tremor.
So medical options would just be pills and medications and things of that nature. But before this procedure was available, she was really struggling. You're going to hear from her in a little bit about her story. Right. How long after this procedure will Evelyn start to feel a difference and feel better?
So patients see the benefit immediately during the procedure, and that benefit persists. So today we'll be able to see the improvement after the surgery and during the procedure.
And I want to be clear because when you first hear this, if you don't know a lot about surgeries and procedures, which I certainly didn't, I hear the word surgery and I imagine there's going to be cutting involved, but this is completely non-invasive, which is fascinating to me. So we're calling it a surgery, but really what's going to happen once Evelyn is inside the room behind us?
So once she's inside the room, basically they'll put her in that magnetic MRI suite, like with the helmet, and then they will direct the ultrasound beams towards the area of the brain region.
So they're directing ultrasound beams and targeting a specific area of Evelyn's brain?
That is correct, yes. And once they target those beams, they will start to see degree of improvement. And initially the intensity of those beams will be low, and over the time they will increase the intensity. And once the improvement is good and she's not having any issues or side effect, they'll increase the intensity enough so that it creates a small lesion in the brain region. And that basically helps to improve the tremor.
And so you're going to use those beams to, in a sense, destroyed the tiny area of her brain where those tremors are involved. Is that the idea?
That is the idea. That is correct, yes.
And the reason that Dr. Sharma is talking about how they'll be able to see the improvement, this is so interesting, as it's happening, is because Evelyn's going to be awake for this whole procedure. So while Dr. Kinsman is performing this procedure, is he going to be asking Evelyn questions? What's going to be happening between the two as this is going on?
Yes, so he'll be getting feedback from her in terms of how she's feeling, if there's any pressure, headaches, or uncomfortable feeling. And then at the same time, they'll be checking the response on tremor. So she'll be doing some activities like trying to write or drawing a spiral, and also like, trying to hold pretend as if she's holding a cup and drinking, so that we can see the degree of improvement.
Wow, all that while undergoing a procedure that 99 patients ago. I mean, she's the 100th patient, so this must be pretty incredible to now be here as the 100th patient is about to undergo this procedure. What does that feel like as a doctor to be able to refer a patient to have something that can be life-changing?
Oh, we are really excited to have to reach this milestone and to help so many patients, improve their quality of life.
Has the pandemic affected how patients can get this procedure? Because it is considered an elective procedure, and those have been put on hold. But as you're about to see, once you see Evelyn's story, I'm sure she wouldn't feel it was elective. It's so life-changing.
Yes.
We have Evelyn coming in now for her procedure. Hi, Evelyn. Hi. How are you doing this morning?
I'm doing fine.
Are you feeling excited, nervous?
I am excited.
Excited.
Yes.
We'll let you take a moment, take a breather, and get wheeled in. Guys, this is such an exciting day for Evelyn. She is about to have a life-changing procedure, focused ultrasound that will give her life back in a sense. And we have Dr. Sharma who is here, Dr. Vibesh Sharma, Dr. Michael Kinsman is going to be entering the fray in a little bit. He's the surgeon that Dr. Sharma referred Evelyn to, who's going to be performing this non-invasive procedure, focused ultrasound, that will give Evelyn her life back and stop those essential tremors. I'm going to let you all watch and see how this is going. Evelyn, family watching this morning?
They may be. I'm not sure. I didn't know until just a few minutes ago that they could.
Oh, wow.
So they may be watching. Yes.
Well, this is so exciting. Can't wait to see how your life changes. And as you can see, Evelyn's a pretty good sport, letting us hang out. Hey, I'm going to get out of your way, guys. If you need to go in and do stuff, I'm going to stand behind Cliff, our photojournalist, and we're just going to capture this in action as they're getting Evelyn ready for her procedure.
It's not easy doing this on camera at 8 o'clock in the morning. But
I mean,
she's in good hands.
Oh, she sure is. This is a team that knows what they're doing, and they do have to shave her head where they're going to be targeting those ultrasound beams, Jess, because they don't want anything in the way. They want to get right to the areas of Evelyn's brain where they can figure out the seizures are coming from. And I'm really simplifying things here. There are a lot of technical and medical terms that they use, but basically what they're going to do is shave her head. In certain parts, they're going to put a brace around her head and tighten things so that they can put this halo around there so they can keep her super stable. And then once they wheel her into the room, she is not under anesthesia. She doesn't need it. They might do some localized numbing around her scalp where the brace is going to be adhered. And then they use these targeted ultrasound focused sound waves in the pinpoint precise area of Evelyn's brain where they believe the tremors are coming from. and she'll be awake. They're going to have her perform certain tasks to see, okay, try to hold this pencil, try to write something, move your hand as if you're lifting a cup of water to your lips. And when the tremors stop, they know that this is working, and she should quickly know as well. This is just fascinating, and I can't stress enough to people watching how grateful we are to Evelyn for letting us come along on this journey with her. She's so brave and being so vulnerable right now, letting us watch so that we can educate everyone and learn about this procedure and talk to her doctors. And you can see how excited she is. If you have any questions that you want me to chime in and ask the doctors, I still have our neurologist, Dr. Sharma, next to me. We're out of the shot, but we're watching Dr. Michael Kinsman, who's the surgeon, shave Evelyn's head and prepare her. This is the 100th. Evelyn is the 100th focused ultrasound patient that Dr. Michael Kinsman is performing the surgery on. This pandemic has also affected things. There were times when elective surgeries were stopped. However, I've talked to Dr. Vibesh Sharma, who says this is elective. However, they are still allowing this because it is a surgery. In fact, while they're prepping Evelyn, I do want to talk to Dr. Sharma about that. We were talking about the pandemic and how this has affected people getting this procedure. What does this mean if we get another surge? Will people still be able to get this focused ultrasound procedure?
Yeah, I think so. I mean, our team is taking careful precautions, and although the pandemic did slow down the procedure because of patients postponing their appointments, but we were screening the patients for COVID and before this procedure, and I think we should be able to continue that, even if there's a surge coming.
Evelyn is so sweet and so brave to let us in, and she's still got a smile on her face. I don't know that I would want a camera on me, but this is how giving people are. She wanted people to know about her procedure and learn about it because she hopes it's life-changing, and she wanted to share her journey with us, and we know we've got the best viewers in the world. We have the best team here performing this procedure. Did you just say she's getting a nice breeze? I don't want to stick my microphone in there while the doctors are doing their stuff, but you look great. You're doing great, and this is going to change your life. Wow. So they're getting the halo ready now. Is it called a halo? I'm calling it a halo. What's it called that you're going to put on her, the doctors and the surgeon are going to put around her head?
So it's a frame. It's called a stereotactic frame, which basically will be fixed on her skull, and that will allow to precisely target the brain region. And basically, once it's targeted precisely, they will focus the high-intensity ultrasound beams and heat up that area of the brain. They'll be monitoring the temperature using special equipments inside, and once they start seeing the improvement, they will increase the intensity and eventually destroy those brain cells.
And we are going to get a chance to talk to Dr. Kinsman in a little bit, but I certainly don't want to interrupt. This is such an important, I'm keeping my voice down. This is an important interaction. They're so caring. You can see that he's been patting her on the shoulder and talking to her, and this is a very important part of the journey as well, this relationship that Dr. Kinsman has with Evelyn, and how gentle he is with all his patients, and they're just prepping her area right now. What will it feel like for Evelyn this is a 3-hour procedure?
Yeah, it can take like 3 to 4 hours, right?
What will she feel during this procedure?
So once they fix the frame, some patients can feel the pressure while they are getting the ultrasound beams. Some patients can have headaches or nausea. Some of the patients can feel a little anxious because they are in the closed MRI.
So she's going to be in a closed MRI area, and then they'll be working on the top of her head with these beams. Is that how it works?
Yes, that is correct. Yeah.
So if she opens her eyes, will the MRI, the capsule that she's in, will that be right above her?
Yes, but she'll be able to see and communicate with the team anytime, and they constantly get the feedback from her. And if she's having any issue, it will be addressed right away.
Right. And so they're so gentle here. When we talk about the pandemic and people are watching this right now and they feel like they're so overwhelmed with everything else happening in the world, at what point should they talk to someone like you, an expert, about this procedure being a possibility? What's the one question they need to ask?
So essential tremor is a common tremor disorder, and when patients start having difficulty with their daily activities like eating, drinking, dressing, so every little activity becomes a challenge for them. I think at that point they should start seeking medical advice. Even before that, if it's causing any trouble with any of their hobbies, because sometimes even a fine tremor can impact a painter as a profession. So they should seek medical advice at the right time. And we know that around 50% of the patients may not get adequate benefit with the medications. So that's a big number.
50% of people who have essential tremor don't get benefits from medication.
Yeah,
this is
they
their
don't get adequate benefit, from medications. So that's when there are options to help to improve their quality of life with these surgical procedures, including focused ultrasound.
How many people do you think are suffering from essential tremor right now in America? How common is it?
So it's about 5 to 10%. The prevalence is around 5 to 10% of the people above 60 years of age.
Wow.
Yeah, so it's the most common tremor disorder.
And it's called essential tremor disorder. She's such a good sport. I don't know what she just said that she's giggling about, but she's over there giggling and talking, and you can see even under their masks the medical staff and our surgeon, Dr. Kinsman, are chit-chatting with Evelyn, and I just can't stress how sweet everyone is in this room and how kind and gentle these doctors and medical staff and nurses and everyone. Dr. Sharma, you've got to go. We only had you for 15 minutes, but you need to go tend to patients and do your stuff. So we're going to say goodbye to Dr. Sharma. Dr. Sharma, thank you very much.
All right, thank you.
Have a great rest of your day. Wow. I'm just going to stand here and keep telling you guys what's happening and let you observe this. I know you have a show to do, but I am just fascinated. If you want to stay with me here, love to have you all come along for this journey. Evelyn, how are you doing? You got a smile on your face. You feeling okay?
Yes, ma'am, I am.
Yes, ma'am. What a champ. You are ready. Now, this is a procedure. We said they'd shave her head, and they just completed that. Now the work is fitting the frame on Evelyn. They need to have this in place so that they can keep her stable and perform this procedure. They need to mark certain parts of her head where they're going to secure the frame. And then once this is secure, they're going to get everything situated, and then she goes into the room. That's to our right, and the procedure begins. And again, if you're just joining us here on the Medical News Network, you are watching the 100th focused ultrasound surgery in full effect. It's happening right now, the 100th here at the University of Kansas Health System. This is our patient, Evelyn. Evelyn she has been struggling with essential tremor. It's called the essential tremor disorder. And she's about to have a procedure that's going to give her life back. Jess, I'm going to send it back to you in the studio as Cliff Irwin and I hang out here outside the procedure room and watch as Evelyn undergoes this procedure. Dr. Michael Kinsman is the surgeon who will be performing it.
Like I said, Evelyn is in fantastic hands. Alexis, thanks for taking us behind the scenes, but a huge thanks to Evelyn for allowing us to to see her prep this morning and the images of her. Dr. Seitz with me this morning.
She and I we were together. I got my head shaved a couple weeks ago. Watched her getting that head shaved. I think she looks great. Evelyn, you look marvelous, and I think we should be pretty
And that's
excited.
why you shaved your head, is for people who go through different types of treatments, have to shave off their head.
It's shaved to save for cancer, and,
That's right.
and Evelyn's getting her head shaved in order to have this procedure. This is a game-changing procedure, and it's so much different than it used to be, and patients are doing great with it. But, I think my only fear is that Evelyn rocks that bald look far better than I do. I look like Casper the Ghost. I'm trying to grow a little bit of hair back here so I don't look quite so ghost-like Jess, but Evelyn rocked it. She looks great.
I walked in the studio this morning, and you didn't have your white coat on, and you had this big, shining, bald
Thanks
head.
for the big, shiny
Glowing.
bald head. Yeah. There may be some pictures of what I look like coming up shortly. There's a brother and a couple of brother in arms pictures of what I look like from Star Trek, and I like to say that I had the face of Picard and the ears of Spock, but I think there may be some other images that have been taken of me from the internet off of Star Trek memes.
Yeah, there have. So we've been having fun with you on this.
Well, it's all good. I'm going to grow it back soon enough. I started to grow it back last week. I said, I'm going to shave it one more time just to get the feel of shaving it, and doing it myself. Used the razor, had my technique down, didn't cut my head off. Thought I was doing pretty good.
Good. You're looking good.
Yeah,
All right,
go.
as is Evelyn, again, our 100th focused ultrasound patient. You are watching her right there. And we want to talk a little bit about Evelyn. She says that this is a chance for her to get rid of a problem that she says, frankly, has really been embarrassing for her. That's what's been her words.
I think a lot of patients who have these sort of medical issues, right? When they go out in public and they look so different, or they can't hold their glass of water without spilling it, or the food comes off of their fork, they don't want to go out to a restaurant, they need help just getting some of the daily tasks done, they can't button a shirt, they can't hold a program at a show. I mean, it's hard, right? It's really pretty hard when you look at the effect of essential tremor on the lives of folks. It's like patients have a terrible cough and they're always in public and they're coughing, or whatever the problem may be. And in this case, the essential tremor is so visible to all of us, it makes people feel different, and it's kind of embarrassing.
Yeah, it doesn't reflect really who they are.
No.
And they may have no other health issues, but just that tremor makes it look like maybe they do, and they don't.
And the good news is that the thing that's changed so much, as they brought up, is that medication can help, especially in the early stages, but it doesn't really address the underlying cause of it, just sort of suppresses it for a while. And then as the tremor worsens, this gets worse. Then later in life, as the tremor progresses, it just becomes more and more pronounced, and you can't do the activities of daily living. Let's say sewing, eating, bathing, brushing your teeth. I mean, there's just so many things that this can affect. And the glory of this is that it is now essentially a non-invasive procedure. Yes, you have to have your head shaved, but you don't have a big incision. So that's a big deal.
Small price to pay.
Yeah, that's a big deal.
Can't wait for her.
And hair will grow back. Trust me. At least I'm hoping that it.
We are trusting you, but it's not looking promising.
Now, you did promise me something for tomorrow's Open Mics program. What did you promise me for tomorrow?
Lots of makeup and
Lots
powder.
of powder. I don't know about the reflection here. I'm a little worried about that in the studio crew. Everybody's going to think really I'm a ghostly image.
I will de-shine you.
And I'm sure the white coat and lack of a collar doesn't help me any.
Yeah, you do look a little different today.
Yeah, it's a little ghostly.
Evelyn is still prepping for her procedure, her focused ultrasound procedure. Again, she's our 100th patient, about ready to be rolled back into the operating room. Evelyn really hopes that this procedure will not only help her stop the shaking, but that her story will also serve as an inspiration to other people out there like her that don't know if they have any hope left. So we talked with Evelyn prior to this procedure. Here is how essential tremor has impacted her life in her own words.
It's been going on 10 plus years, and I'm on the highest dose medication that they can give me. It's kind of embarrassing. And then when someone walks up to you and asks you why you're shaking, and you explain it to them, and then they look at you funny like, well, that doesn't make sense. It just kind of hurts your feelings. Sometimes it's hard for me to eat. I have to eat with a spoon now a lot of the time. I can't eat with a fork. Sometimes I have to put a straw in my drink because I just slosh it everywhere. In fact, I had a urologist that I had gone to for years. He said, I know nothing about essential tremors. And I said, after you have doctored me for years, you know nothing about essential tremors? And he said, no. He said, I'm just giving you the medication that your original neurologist, which he retired, gave you. I just wanted to go and talk to someone about it and see if I was a candidate for it or if it was really real. I had not even heard about it. I got on the computer and started researching because here at home, all they wanted to do was cut into my head and do a surgery that there was some terrible side effects. I could have a stroke or I could come out as a vegetable, and I wouldn't let them do that. Well, I'm excited in one way, and I'm a little bit nervous, but not a lot. There's a lot of people praying for me, and I know that everything's going to be okay. I know God's going to protect me and have his hands over the doctor's hands. And so I know that I'm going to be okay.
She is just so precious and such a good spirit, and she is in good hands, and she's going to do fantastic. She's been prepping this morning. Alexis Delcid has been out there live, kind of walking us through how they get these patients ready. Again, she's our 100th focused ultrasound patient here at the health system. We do have a question from one of our viewers, and Dr. Stites, I don't know if you can answer this. I know this isn't completely your lane, but curious if there's a test for essential tremor. I know you did a story on this on open mics with Dr. Stites, and so I wanted to see how do you know the difference between, is it this or is it something else like Parkinson's?
You know that, right? The neurologist that you see will help define that for you. And it's really about what other symptoms go along with it. They may do some imaging of your brain to make sure there's not a tumor or something of that nature. But by and large, this is a diagnosis that is made at the bedside by the neurologist and the team of folks who are taking care of you, sometimes with the help of a little diagnostic tool as well, like a CT or an MRI.
All right. Well, let's check in now with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count. Good morning to you.
Hi.
Hi.
Yeah, you saw Dr. Kinsman in there, just looking at the care he takes with his patients, doing the clipping of her scalp. So worked with Dr. Kinsman a lot, great surgeon, and of course all of our neurosurgeons led by Dr. Paul Camerata as well. So right now here in the hospital, again, we are continuing to do very well. 5 active infections, 0 in the ICU, 0 on the ventilator, and 9 in that recovery period. Overall, again, what we have seen nationally is that there has been a slight uptick in cases. We have seen a slight uptick in hospitalizations, although not really equal to what we've seen before with number of cases and hospitalizations. That's good news. Same thing with deaths. We haven't really seen the increase in deaths yet at this point in time. I think that is all continues to be good news. I think a lot of that has to deal with immunity that we have gained as individuals, mostly through the safest way, through vaccination, but of course those people that have been just had infection and reinfection as well. So,
just a couple thoughts.
Yeah.
You know, the numbers across the country are up about 300% since early April, so it's been a significant rise. To Hawk's point, we're not seeing the rise in hospitalizations yet. That's not completely true. We are seeing a slight rise in hospitalizations, but nowhere near what it was like before. Right now, the case count across the country is as high as it was in the Delta surge, but you're not seeing the hospitalizations. And so we hope that trend continues. I think with Hawkeye's right, it's both a combination of vaccination and natural immunity and maybe a little less severity with Omicron, although I think that's debatable. If you were to give an Omicron to a population, Hawk, that had not been vaccinated, had not had COVID, I think it would behave differently, which is what you see in some other countries.
Yeah, and I think that's exactly right. There was a preprint looking at that Omicron versus the other waves, and they said that it wasn't really less severe as a virus or an illness, but because of natural immunity from infection or reinfection or through vaccination, that has been good. The other thing we have to remember too is that these are notified cases. These are counted cases because they're doing PCR. We haven't even counted the people that have done at-home testing or not tested. So you have to imagine that's probably 2 or 3 or 4 times more of what the actual cases are, but we aren't seeing that rise in hospitalizations and death. And so I think that is overall a good thing. I'm going to attribute most of that to vaccination-induced immunity. But also now we know that you have Paxlovid. So if you have symptoms, please get tested early, get on Paxlovid early. These will all help reduce your chance of going to the hospital.
And I think that's an important point, because if you look at the percent vaccination in those who are 65 and older, who's still at the most highest risk for hospitalization. We'll look at some of those graphs tomorrow on open mics. But the reality is that the 65 and over 90% vaccinated in the U.S., and that's a really big deal. And I think that's incredibly protective.
I just want to check in with Evelyn really quick. She's doing her writing test.
She is.
So this is how they're going to tell if this is working?
Yep.
Writing her name, and then
as they do the procedure, the writing starts to improve, and it's pretty dramatic.
That's fascinating.
It is fascinating. And to think you could do this with an ultrasound wave that heats up the part of the brain where the tremor is coming from and tries to eliminate the tremor, that's amazing. I mean, guys, I can't tell you how far this has gone.
And they're talking to her while this is all happening.
Yeah. Getting her feedback, making sure she's feeling okay, making sure she's not having any other funny symptoms. So yeah, no, it's approximately a very big deal.
Indeed it is. All right, I do want to jump back to COVID real quick, because the FDA is expected to authorize the Pfizer booster for 5 to 11-year-olds. What do you guys think?
I think it's a great idea, and I think we also got to remind people to get a booster. I think we're about ready to show some examples of that, aren't we?
We are. You're getting your booster.
I'm getting my booster on the air.
Well, so while you're doing that, Dr. Hawkinson, I want to ask us, the questions are going to start flooding in. My kid's been healthy. My 11-year-old is okay. Do they need a booster? What kind of recommendations do we give?
Yeah, I mean, first of all, we want to wait to see what the recommendation is, but I think it's smart. I think what we have learned throughout this pandemic is it's really those 3 exposures to spike. If your children haven't been infected, if they are vaccinated, it's important to get that booster dose. That is really going to help increase the breadth of that immune response, both T cells and B cells. You know, there may be some small benefit of helping protect against infection a little bit, but also we know the benefit of vaccine in helping reduce the risk of long COVID and multi-system inflammatory disorder as well. So I think all of this is good to do. We'll just wait for the full recommendations.
A couple of quick points though too, right? Because Moderna's going in for their authorization of 5 to 11, so that's going to be helpful. We'll have more than one shot. Secondly, to Doc Hawk's point, you know, you're trying to prevent long COVID, et cetera. Even though the rate of hospitalization isn't high in kids, it is still a rate, and there are still some long COVID, and there are multi-inflammatory syndrome kids. So I think the data looks like you're still going to prevent that with vaccination. You may not prevent infection as much, right? Disease transmission still occurs. With Omicron right now, it's predicted that if you look at those maps, that the rate of death is 10 times less amongst the vaccination of those who are vaccinated, but the rate of infection is only about half. So it's not quite the difference we saw earlier, but people who've been vaccinated are still not getting as sick. They're not the ones dying in the ICU, whether it's adult or children. And that's why we all should get our booster. You know, Hawkeye, one of the big questions has been, for adults, when do you get your booster? I've waited my 6 months, so I'm going to get my booster right now, because I think it's time to do it. But some people, Hawkeye, are asking me, gosh, should I get it now? Should I wait to the fall? I think you should do both, right? If you're over the age of 50, go get both.
Yeah, I think that's probably the best advice, Dr. Stites. You know, getting that, if you're over 50, get that booster as it's recommended. I think that's important, keeping you healthy until then. And we don't know what's going to happen in the fall. We know they are looking at different vaccines. Bivalent vaccines, meaning there may be the original spike, but they're also looking at the pivoted spikes, such as Omicron, those types of things. There's just going to be some new information and data coming out within these next few weeks, probably about those types of things. But I think with knowing what we're knowing that it is still high prevalence of virus circulation, if you are in that time frame where you need that booster and you meet that criteria, go ahead and get your booster.
I think that's right. I think that bivalent thing is going to be a very big deal. I want to say thank you to Grant for giving me that vaccination. I'm ready to rock and roll, baby. He moved in as very stealthy,
I know, and he got the long straw today, because I would give anything to be able to do that. Just
you really wanted to do it, didn't you? Yeah, I'm sure you did.
One of these days.
Makes me feel loved.
I give lots of love.
You'll really feel loved if I get my powder. That's what I really want.
I will get you your powder tomorrow. I know you have to scoot here in a couple minutes.
I gotta run.
But how? how have you been feeling after the shots? So
Good.
the first booster, have you had any major
You know,
reactions?
the first shot I was fine. The second shot I was a little sick. Booster, no problem. We'll see what this one brings in my second booster. So I'm ready to go.
Okay.
I still got to go to clinic. I got to go round, go to clinic, go back to rounds, and so it'll be a busy day. But I do think that you want the protection, and I think it's important to stay boosted. You can still get Omicron, you may still get infected, but in the long run, what you want to do is not come in the hospital. You don't want to get really sick, and even though the rates of hospitalization and death are nowhere near so far as what they have been, that's because we have an immunized population. And you know, if 70% of Americans and 90% of those over the age of 65 have been immunized, that's a good part of the reason why people are doing well. And Hawk, we just got to keep them there, keep the booster going. And I think you're right. I'm with you. I bet this fall we're going to be having booster shots that have a mix of different types of viral particles in them.
Yeah, absolutely. And they're looking at other enhancements to these vaccines to even help and enhance the protection against infection itself. So I think it will be exciting within this next year. Hopefully within these next few weeks or 1 to 2 months, we'll see more data coming out about those types of things.
And the last thing is, if there's some developing news, I think hopefully we're going to see some good news about doing nasal spray for vaccination, which will be a complete game changer at that point.
Yeah, and certainly hoping that that does add more to our mucosal immunity, the immunity that we get in our upper respiratory tract to help prevent infection even further. So that is certainly interesting. We had a question about that this week. Not too much more information than we saw 1 or 2 months ago, but hopefully that trial is still going on, producing good data.
All right, that was your final thought. That was a good one. I'm going to let you go.
All right, thank you, ma'am.
But don't get sick. You've got to be back here for your show
I'll be here tomorrow. I'm looking forward to it. And
all right.
Thanks to Grant.
Thank you, Grant. All right. Well, we've been talking about our 100th focused ultrasound patient, Evelyn, today. We want to show you the huge difference this focused ultrasound procedure made for the first 3 patients to undergo it last year: Don Heaney, Judith Eames, and Rich Schaefer. Before the procedure, each was asked to trace a few things on a piece of paper and then write their names. As you can see, they're writing barely legible, very shaky. That's all because of the tremors. Now, look at the amazing transformation afterward. The tremors have all but disappeared. All 3 were able to write their names. So totally life-changing. And we are going to check back in with Alexis Del Cid, who is live outside the OR this morning, telling us how things are going. Evelyn has done such a great job preparing this morning. And Alexis, just kind of get us up to date on what's going on.
Jessica, they just brought Evelyn into the surgery room. So what they're going to start doing is they're going to start putting the focused ultrasound, these targeted sound waves, on the area of her brain where they think the tremors are coming from. And as they're doing this, they're going to be talking to Evelyn, asking her questions. She's going to feel pressure, but that's about it. But they're keeping her completely awake. She's not sedated in any way because they need to ask her questions and they need to have her do certain tasks with her hands during this procedure. Again, it's called the surgery, but it's non-invasive. There is no cutting. It is just sound waves. So they're going to ask her to answer questions. They're going to even give her a clipboard and have her write things. As Jessica, you were talking about, they're going to compare her handwriting from before the procedure. As you saw, they had her write some things down, and during the procedure and after the procedure. And as Dr. Stites was telling us, you're going to expected to see a huge difference and an improvement. This is going to be life-changing. This procedure is expected to give her a chance at getting her life back. She's awake. She'll know very soon. She'll be able to feel the difference. This is an elective procedure here, but Dr. Sharma says that it really, as far as elective surgeries goes, this will be a thing that allows Evelyn to do everyday tasks that so many of us take for granted. Even things like putting a mask on. She'll be able to do that. Write her name. Hold a cup of coffee in the morning. Go get something out of her wallet. Drive. Get something to eat. This was developed to give patients a chance to stop those tremors. Dr. Sharma was telling me, Dr. Sharma is the Her doctor who referred her to the surgeon, Dr. Michael Kinsman, who you're watching right now with his medical team perform this procedure. Dr. Sharma says for about 50% or more of people who have essential tremor, medications don't work. This is their option to stop their tremors. It's one of the most common tremor disorders, essential tremor, and Evelyn has it. Unfortunately, it's also something that has really robbed her of everyday things. So what you're watching now is the procedure underway, these targeted sound waves that they're going to be targeting at certain areas of her brain. It's expected to take about 3 hours. They're in the surgery room right now, and then there's also an observation room, an MRI control room where other members of the medical team can watch on a screen. Evelyn has been so brave and such a great sport. She has let us come with her every step of the way, from telling her story. And Cliff Irwin, our photojournalist, has been doing an amazing job taking us behind the scenes in the control room to give you a little bit of a different vantage point. Evelyn, as you saw earlier, let us interview her, and she wanted to talk about her situation and shared her story. And then as she was wheeled into this room for prep, she was smiling and talking and so hopeful as the surgical team began another process it's a really big deal. They shaved her whole head right in front of us, and she gave us a thumbs up and said, "I'm feeling good, I'm feeling hopeful." And then we watched these gentle doctors and nurses and the surgeon. This whole team was talking to her, stroking her shoulders, telling her she was doing a great job, really helping to just make sure she was calm and comfortable throughout this procedure that would be scary. I mean, let's face it, going in to have anything done in a hospital can be very stressful, even when you have the best team and you know you're in great hands. Having something performed on your brain, that can be scary. And you could tell that she is surrounded by people who are making her feel she doesn't need to be afraid. They are keeping her comfortable every step of the way. This is the 100th patient, which is remarkable for this whole team. The 100th patient who's getting this procedure for her essential tremor here at the University of Kansas Health System. And this is a very special day, and this is something that I know we're all going to remember because they've been so gracious as to let us come along for this journey. And I'm really looking forward to keeping in touch with Evelyn when she comes out of this. I know we all are, just to see how her life changes and how important this is. So that's Dr. Michael Kinsman. He's the surgeon. He's explaining to Evelyn every step of the way what he's doing. They're giving her a squeeze ball right now. And that's what she has in case she gets nervous. She gets scared. She has a question. She just squeezes that little squeeze ball in her hand. And they stop everything and they answer her questions. So this is a very interactive between Evelyn and her care team here procedure, and they want her to be as comfortable as possible. Jessica, I'm going to send it back to you in the studio.
Alexis, you mentioned it. That's one of the great things about doing medical journalism is that you meet these patients, and then the exciting part is to be able to talk to them later after their procedures and after they've made it off the medication, because I know Evelyn mentioned she was on the highest doses of medication and it still wasn't working. So it'll be so exciting to keep in touch with her and find out how she's doing. So I know we were hoping to talk with Dr.
And how far we've come.
Exactly. Yeah. Absolutely. Absolutely. And I know we were hoping to talk with Dr. Kingsman today, but I know he is busy in the OR with Evelyn. So we're going to get to a couple of viewer questions. And Alexis, thanks so much for that play-by-play this morning. We appreciate it. It really gave us a great vantage point.
Yeah.
All right. Any reporters on the line? Are we good on reporters? Okay, I am going to ask a question. Dr. Hawkinson, these are coming your way today. So Melissa wants to know, she said, did I hear Jess correctly? And I'm hoping she did. So check me out. If boosters for 5 to 11 are approved today, they can receive their booster today. Will they be available today?
That will be the FDA approving them. Typically, We have seen that they have to go through ACIP, which makes the recommendations for those boosters, but we know that when the booster recommendation came out for 50 and over, ACIP did not meet. Those recommendations just went in. So I think we have to wait and see ultimately what goes on. We know historically the pediatric vaccine dosing has been a little bit different than the adult. So I think we just have to wait and see. There is that possibility, since we have so much data about the vaccines in general and that age group at this point in time, that once it's recommended by the FDA, that we will be able to do that.
Katie wants to know, individuals with CellCept, should they take Evusheld monoclonal treatment?
Yeah, I mean, I think that really we can make broad definitions of immunosuppression. CellCept is certainly an immunosuppressive drug. I think that would be reasonable to go ahead and get Evusheld. I would still get the vaccination as well, but go ahead and get that. That will offer even further protection.
And Angela wants to know, why do some people have a bad reaction with the booster than others?
I think it's just heterogeneous. It's just variable. You know, some people do have a reaction, others don't. Some people had the reactions with the first or second doses, other people didn't. So I think it just varies. And again, there is no way to measure your immune response to the vaccine by getting side effects or not getting side effects. But again, some people will just have those adverse events. The vast majority of those are short-lived and are not serious.
And last one for you is from Joyce. For patients receiving Paxlovid, I'm hearing many have an overwhelming metallic taste in their mouth.
Yeah.
Is there anything people can do about that?
I don't think there's anything to be done. I've heard the anecdotes too of the metallic taste. It does go away eventually. And again, the Paxlovid is a 5-day, it's a short course. Please continue to take the whole course of medicine. Do not stop because of that metallic taste. It should go away. I don't know that there's anything really to be done to help with that. Could certainly try to talk to our ENT colleagues about that, but I don't believe there's any even symptomatic things to do for that.
We are going to send it back out to Alexis Del Cid. She was able to catch up with Dr. Kinsman and find out how Evelyn's doing.
Yes.
Get us up to date.
I'm here with Dr. Michael Kinsman. He's the surgeon who's performing this procedure. Dr. Kinsman, you're looking at some images right now. What are you monitoring?
Yes, at the moment, we have, before we even do the procedure, we get a CAT scan of the patient's head. And what it does is it gives us the opportunity to see how efficient the patient's skull is, how we'd be able to deliver that sound energy to heat up the spot inside the brain that we actually want to heat up. And there's some patients that have a really low or kind of a difficult skull where it becomes really challenging to perform the procedure. But in Evelyn's case, she's actually got a really great efficient skull, so I think her treatment should go pretty nicely.
Oh, that's such good news. And how soon after or during this procedure, how immediate will it be that Evelyn feels the difference and feels the change in everything?
So right now, the main part, or what we're going to be doing right now, is more just the planning side of it, planning where we're going to produce that little spot, the heating spot. And part of that is we're going to get an MRI in a little bit here, so I can make sure that we're able to do that. And then we do a series of targeting we call sonications. So what that means is we deliver some of the sound energy to make sure that our spot looks good, that we're happy with where it is, it's accurate, and the shape of the spot is what we want it to look like. After that one, those set of 3, then we do what we call a verification sonication. That verification is exactly what it sounds like. So verify that we're in the right place, getting good results, we're noticing her tremors getting better, she's not having side effects. And once we're happy with that verification, then we go on to the real treatment part of it, where we make those permanent lesions. But during that verification is when she really notices changes.
What's the recovery like?
So recovery is typically a couple weeks. And it's mostly them getting their energy back. This takes a lot of energy from them, not because it's a big surgery or making big incisions and things have to heal that way, but patients still feel a little bit tired, a little bit more quickly. And some patients will notice a little bit of some mild headaches and some other small side effects, kind of minor side effects, and just to recover from all of that takes a couple weeks.
Can you tell us her prognosis after the procedure is complete?
Yeah, so I think she has a, most patients have a really drastic improvement in their tremor, and anywhere from about 75, 80, oftentimes over 90% improvement in their tremor. And so I expect a very similar situation for her.
Evelyn's the 100th patient. How does it feel to be on patient number 100?
I honestly am just really happy. We have a great team here with the movement disorders neurologists, our MRI tech, our anesthesiology team, our nurses that have allowed us to get to this point. And it's just fantastic to be able to help all these patients.
Well, it's fantastic to see you in action. This is incredible. I'm going to send it back to you in the studio.
Alexis, doctor, thank you so much. Dr. Hawkinson, just you and me. Final thoughts from you today.
Yeah, I mean, I think exciting news overall. We know how much vaccines help. We know how effective they are at preventing death, hospitalization, severe disease. We know that new information is coming out about pediatrics getting their vaccines, either it's booster or even those who are younger than 5 getting their vaccines. So in the next few weeks, we'll definitely be having more of that information. I know a lot of families, a lot of parents are going to be happy about that.
Absolutely. I'm one of them. All right. Thank you so much for joining us today. Don't forget, you can catch our show anytime by logging on to Facebook, YouTube, and Twitter. See you tomorrow. World events are impacting healthcare here in the Metro. Wednesday on Open Mics. The latest supply chain break due to COVID and how it's impacting time-critical diagnosis. Plus, the question you need to ask your insurance. Join Dr. Stites at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.